Welcome to How to Conduct a Literature Review module. This module is intended to help you provide a justification to support your research project. It is just one method for conducting a literature review. The next few slides will provide an overview on the steps for conducting a literature review. The first step in this process is to develop a list of questions that will drive your literature review. This list of questions provides the scope or the inclusion criteria of articles that you will include in the review and helps you focus the amount of articles you need to review to create your justification. For example, if we wanted to research healthcare disparities in relationship to diabetes, we might want to know who studied the relationship between healthcare disparities and diabetes. Has it been what were the factors that were studied, what was the purpose of the studies? What were the interventions or the outcomes that were achieved through these studies? And then I have a couple of questions that I always include, such as what methods were utilized to conduct the study. So when I find an article that is good, I might want to look at how they conducted their study. I might also want to know if there were barriers to the research, and if the author had recommendations for the next step. That's important later in determining where you want to start your research. The next step in the process is to conduct a quick search and import your citations into a citation manager. The third step is to insert your search history, your questions, and your citations into one Word document. This is an example of how this document might look. So I would title my document. I would put the date that I conducted the search. I would add the terms that I used to conduct the search. And then I would add my research questions underneath that. So all of this information will be accessible at a later date. This next slide shows you how the annotated bibliography will follow my questions, and you would have your citations and all of the abstracts for all the articles that you're going to review based on the quick search in a Word document. And this is really important for purposes later if you want to, when you want to write your abstracts or submit a publication, you will know what search terms you used. You might have to put in your methods section that you reviewed articles from this date to this date using these key terms, or you would have to also provide classifications for terms that you might want to file your article under the same terms. So this is an example of that document. So the fourth step is to read all of your abstracts and to note which abstracts you would want to pull full text, and if there's a number of a question that you think it might answer the abstract, then write that in the margin as well. So here's an example of this. In my Word document, I might write Q1, Q5, Q6, and then pull full text. So that's just a reminder to me when I pull this article's full text that I might want to focus in on if the full article answers those specific questions. When you print your full text, I have a system for coding the articles. The system is comprised of the first author's last name, the year the publication was made, and the citation, the reference manager's number. So in this case, it might be Ryan, 2014, number 1. The reason I add the first author's last name is that every time you touch this article to take a note or to read, you're going to start remembering the first author's last name. It will help you develop confidence when you present and you have to talk about who contributed to this body of literature, or even write your protocols. The year that it was published is important because there might be an author that's published on the same topic in more than one year. So you'd want to differentiate by year or possibly by the number itself, so you can go in specifically and pull that number. So read and take notes. how I recommend taking notes is using Excel. I recommend Excel or some type of program where you can sort, because if you add a column for your article code, so your first author's last name, the year it was published, and the citation number, add the question number, and then add your note. You can then manipulate, at least through Excel, by question or by author. And that might give you a different perspective on gaining an insight of where you need to start your research project. So the next step is to create a visual overview of where the questions are answered or unanswered in the literature. Here is an example of how that might look. So you would add a column for all of your articles, you would have article codes, and then you would add columns for every question you have that drove your literature review. Put an X in the column where the article answers a question. So for example, question number 4, no one has addressed, but a lot of people have addressed question number 5 and 6. So you could either create your justification based on author's recommendations of next steps on an area of research that's already been accomplished, and that's where your project begins, or you can use this review as a justification for exploring an area of research that has not been covered before. The big take-home message for this step is it's just one way to conduct a literature review, but it gives you a process for having one document, or 2 documents really. So you have one document that contains your search history, your questions, and your abstracts and annotated bibliography. You have another document that contains all of your notes and provides you a visual overview of where the holes are in the literature or where questions are answered. And this systemic way to conducting a literature review helps you create the justification for your project, which is essential for building on what's already been done, or getting your hospital leadership to buy into your project. So a big part of the message is this step in the research project is work, but if you do this piece really well, it pays for itself down the road. Thank you.